Okay, so first of all, I think I know everybody, but just in case, a reminder, it's been a while since we've seen each other. My name is Sorcha McPhillips and I'm the Chief Executive of HDANI. And the reason we're having this session today is because normally we have our annual conference, and the conference is an opportunity for the board to talk to the service users and to meet families and have a chat about the work that we do. But this year, obviously with COVID, we didn't have that face-to-face. So this is just a wee chance to get to know our board members and find out a bit about the work that we're doing and ask any questions you might have about what the charity's doing, about finances, anything you have an interest in particular. And after today, you can always, if you think of a question or anything, you can always drop us a line or ask Zélie, and she'll pass things on to us as well. All right. So I'm going to introduce each trustee that we have here today. I'll say first of all that Jerry Mcdermott, who's our chairperson, who works for Kingspan International. He's their HR Human Resources Director, Global Human Resources Director. So I know he's been caught up in a few different business meetings this week, so he may be able to join us, and if not, then I'm sure he'll fill in some other time. And the other person who's not with us today is Dr. Seamus Kearney, who's a neurologist, and he's just got some clinical commitments today, so he couldn't join us. Okay, so I'm going to just start from the top, and the first person I see is Richard. So Richard, if you want to introduce yourself, I'm going to prompt you just to unmute yourself there now.
Hi, thank you, Sorcha. Richard Hamilton, for anyone who doesn't know me here so far. I joined what was the Belfast group, the original Belfast group, way back in about year 2002, 2003. I found that a great help because I realized for the first time that I wasn't working alone with HD. My wife unfortunately had HD. She contracted that and unfortunately passed away in 2007. So since then, I found that there was an opportunity to join the board, and I felt that that was an opportunity to give something back into the system, a system that had given me so much. So that's by way of introduction. That's it.
Thanks, Richard. And beside Richard on my screen, I have Janice. So, wait, Janice.
Hi, my name's Janice McCartney, and my family was affected by HD. My dad passed away almost 9 years ago, and my granny had it before that. Quite a lot of my family, my cousins with it as well. And I decided to join the board because up around this area, there's nobody to for the families on the board to represent them. So I thought I would give them a little something and try and reach out to more members of HD families, which I know there's a few up around here that isn't on in the charity, to reach out to them maybe, hopefully, through time.
Janice, do you want to tell people where you're based?
Sorry, I'm in Armagh, outside Armagh, but I had done it. Right. Yeah.
Okay, no worries. And then we have Raymond. Unmute yourself there.
Yeah, good afternoon. My name is Raymond Crilly. I don't have any connection family-wise with the charity. My involvement started with, I work for a company called TBF Thompson, and one of my people who works with me, a guy called Glenn Spence, who's actually related to Amy. Glenn's family were affected by HD, and originally the business got involved as a sponsoring and doing a bit of printing and various things and helping Sorcha sort of get the word out there. About 3-4 years ago, Sorcha, I don't know what you call it, coerced me onto the board, but persuaded me onto the board. So my background is I'm a chartered accountant, so I suppose I felt, well, it would be something that I could maybe lend some of my expertise, and as a result I've ended up as probably treasurer. When the previous treasurer retired, I was originally the secretary and then became treasurer. Thank you.
Help, wouldn't it? Next we have Amy.
Hi, so I am the niece of Glenn Spence that Raymond works with. My granda had Huntington's. We found out in like 2012, I think. I was in first year at university. On one of my trips back home, I found out my family had already found the charity. So started to get involved in a bit of their youth and a few of the camps. My granda had 2 children, my mum and my uncle. My mum tested negative, therefore me and my brothers are negative, but my uncle and his 3 daughters are still at risk. We're a really close family, so I think it's so important for me to try and do what I can to maybe not prevent anything, but to try and help should anything happen in the future. The youth would have a really big place in my heart, and I think it's really important to try and make it the best it can be as well. So that's why I joined.
Great, thank you, Amy. And now we have Lauren.
Hi, my dad and a lot of our family have Huntington's disease. Are from quite a big family in County Down, South Down. I also work in Huntington's disease research in London, and have had the privilege of being able to work in a specialist centre over there and see some of the care that can be provided to Huntington's patients and families that we don't quite have over here yet, and know what's happening kind of in the global scene in terms of research and future trials. So a big passion for me is to try and help whatever way I can to get research going for families back at home, and give any advice in terms of what we should be trying to develop and what we can do for in terms of the care pathways as well.
Great, thanks, Lauren. Okay, so in Jerry's absence, I'll just speak to you for a couple of minutes about what the role of the board is, just to get an understanding of what its function is and what the purpose of a board is. So every charity is legally required to have a board of management, and people on a board are generally referred to as trustees. So essentially those people are entrusted to ensure that the company, or that the charity is running effectively, is doing what it's supposed to be doing, is making good use of its funds, is complying with all of the relevant laws and policies that have to be complied with. But also most charities are also registered companies, and HDANI is no different. So we're also a registered company with Companies House in the UK. And to that end, our trustees are also company directors. So they have a legal responsibility, again, to make sure that we're complying with all of the relevant laws around finances and governance and things like that. So in essence, the trustees are responsible for the overall running of the charity. And they are essentially the employers as well. So the trustees employ me to run the charity, and employ Zealy and Ashley and anybody else. So they're legally responsible for ensuring that employment law is followed as well. So they have a duty of care towards both their employees and also the beneficiaries of the charity, which would be our HD families. And every charity is required to have basically a set of rules that they operate by, and these would be referred to as governance documents. So they would set out how the charity operates, who they support, where they work, how often the trustees meet, any kind of rules and procedures around how we operate. So the trustees basically have to follow these rules and make sure that everything is done as it's supposed to be done. So the way we operate in principle is that every 3 months roughly, the trustees will have a meeting, and I, as the chief executive, will report to the board about what our activities are, what we've been doing, what we're planning to do, and we will work with our auditor and accountant, Tony, to make sure that we keep on track of our finances and highlight any issues that might be relevant for the board. So if, for example, we were getting particularly low on funds, or certain kind of red lights that we'd flag up to the board and say, we need to make you aware of this, so that the board can make decisions about how we can best secure the services of the charity. So there's basically legal responsibilities that board members have to make sure that the charity is running as effectively as possible, is following all of the relevant laws, and is making the most impact it really with our service users. And then from a day-to-day perspective, it's kind of my responsibility then to run the charity, to manage staff, to develop projects, to fundraise, to monitor our finances, to take care of things like budgeting and policy development, to reach out to other organisations, to deliver training, to develop kind of information resources and things like that. So the day-to-day stuff is on me. And then, as I said, I report back to the board. So each board member with us has a kind of area that they are working on or have a particular interest in, or they're kind of generally looking at. So Jerry is our chairperson. So his overall responsibility would be to run the board essentially. And he's the personnel person on the board. So he's responsible for line managing staff. So in essence, really, that's just line managing me, who line manages anybody else. So that's Jerry's kind of main job. Raymond, as he mentioned, is the treasurer. So any issues we have in relation to money, planning and budgeting, looking over grant applications, things like that, will fall to Raymond. And Raymond and Jerry are also responsible for signing out any money from the charity's bank accounts. So every month there'll be staff salaries, there'll be different invoices and things like that, and it's set up on our account system so that Jerry and Raymond have authorised that and make sure that the money is going where it's supposed to be going and that people are paid in time, etc. Lauren has already said that she's a particular interest in research, and Lauren was poached specifically for that reason. I think I hunted her down at a conference to try and get her to join our board. So Lauren is probably one of the most modest people you'll meet, but she is a huge brainiac and a fantastic source of information about research on Huntington's disease. And obviously she's a personal passion as well because of her family connections. So Lauren and I are working on a particular push towards trying to get research centres set up in Northern Ireland to allow families here to participate and enrol HD. And hopefully that would prove to be a route towards accessing therapies in years to come as well. Beyond that, Richard has a particular interest in making sure that our service users are as involved as possible in the charity and in our decision making. And that's something we're still kind of exploring, but Richard was really pushing for us to have this session today so that there'd be an opportunity for service users to engage with the board and to find out about what we're doing, and if anybody has an interest in maybe getting involved in the board, that they can do so. Amy has already mentioned that she's a huge passion around youth work, so that's something we're touching on at the minute, is trying to explore how the youth side of things can be more reflected in the work of the board. And Dr. Kearney, as you know, is a consultant neurologist. So Seamus's focus is really around service development and making sure that HD families have access to appropriate services. So Seamus now will be working on lobbying work, I suppose, with the health and social care teams here in the trusts and the Department of Health to try and make sure that services are appropriately developed. What we'd really like to do is get a HD care pathway developed, so a regional pathway that no matter where in Northern Ireland you are, once you come from a HD family, that there is a clear steps to how you can be provided with support and care throughout your journey. So whether it's from predictive testing to somebody who's started to show symptoms and needs diagnosis, and then support for the other family members and their carers as well. Now, it's sad to say that this is not an easy or quick turnaround of work. Things take years and years and years and years to develop. And even that's when you're a complete, there's loads of words you could apply to me, but I'd say persistent. We'll go with persistent is probably the most diplomatic. So even though you're kind of constantly pegging away at things, it can still take a long, long time to get any kind of movement. But just want to let people know that we are, even if you don't hear of any dramatic changes, that we are constantly chipping away in the background and trying to make things better right across the board. So that's a kind of general overview of what the board are supposed to do legally and what they actually do in practical terms and what their particular interests are. Our main, I suppose, focus is obviously on service provision and supporting families as best we can. But I suppose you could summarize it in kind of 4 different areas. So we try and raise awareness and educate people about Huntington's disease, and that's family members, but also health and social care professionals. We try and support and connect families. So that would be through our family support workers like Celie, or the work that we do with Ashley and the youth And then they kind of bring in people together as best we can to give them an opportunity, whether it's through support groups or through our social events or befriended opportunities and things like that. The families can build up relationships together. And the other side of the work that we do is around, I suppose, lobbying. And that's really pushing for service improvements right across the board. So I guess a lot of that work, as I said, would be background work that people wouldn't necessarily see, but it's really important because it impacts on people that aren't even engaged with the charity. So even if we're doing something that has a wider impact, I guess, so if there's families that aren't connected to HDANI that still benefit from it in the long term. So whether it's educating more health and social care professionals, so when somebody goes to a GP that Huntington's disease isn't a brand new word to them, or whether it's helping to develop policies or consulting and legislation, things like that's happening. There's a benefit to all HD families, whether they realise it or not, I suppose. And I suppose to get a sense of how many people we currently work with, when I came to the association, I guess 6 years ago, maybe now, there were about 30 families that were connected to HDANI right across Northern Ireland. And those families were engaged in different ways. You know, a few core people would go to support groups in different areas, and other people might come to conference or, you know, the odd event. But now we have probably over 200 families, realistically. There's 128 people with Huntington's disease, either symptomatic or with a predictive test, that we would be connected with. And in total, there's just over 750 service users. So that would include those people with Huntington's disease, their carers, other family members, so people at risk of HD themselves, people who've tested negative, so all kinds of different aspects. And then as well as that, we include obviously children as well that we're engaged with. So that's just the people that we're connected with. The reality is that there's an indirect benefit to other people as well, because within a family, we might be speaking to one person, but the support we provide to them has an impact on the whole family. It's the well-being of the family and the knowledge and information of the family, which is great. But on the flip side of that as well, we know, and a lot of you know yourselves, that there's a lot of family breakdown and dysfunction within families. So some families are more difficult to engage than others, and there's still a lot of stigma and secrecy around HD. So even we could be working with one family that are quite open with it, but maybe the sister or brother of that person doesn't acknowledge Huntington's at all and won't talk about it and won't engage. So it's quite difficult to get a sense of how many people are actually affected. But speaking with Professor Morrison there just recently, we tried to get a sense of the estimates at present on how many people with Huntington's disease there are in Northern Ireland. And he reckons that there's approximately 285 people. So that would be people who either have HD and have tested positive for HD, or don't know that they have HD, but the prevalence rates would estimate that's how many people have it. And some of them would be symptomatic as well, so we would all list that. And then the estimate that is conservative enough, but as many as 5 people, for every one person you know has Huntington's, would be about another 5 people who would be at risk of inheriting it or developing it at some stage. So that puts that figure just over 1,035. And at the minute, we're probably reaching about half of those people. So as I said, we've got 128 people that we know have Huntington's disease out of a possible 285. And that's not good enough as far as I'm concerned. You know, we really want to get out there as much as possible. So we use all kinds of communication methods to try and reach families and reach individuals. And that's fine to some extent, but really the key, as far as I'm concerned, is trying to get into GP practices, which tend to be the first point of call for people. So one of the projects we're working on at the minute is to try and take advantage of what they call the multidisciplinary team rollouts across the GP practices. And that's to say that over the next few years, every GP practice in Northern Ireland should have a mental health professional, a social worker, and a first contact physiotherapist in their practice. So what we want to do is make sure that when somebody refers to their GP and maybe has queries about testing or knows they're from a HD family or start to be symptomatic or have a concern about a loved one, the GP recognises Huntington's disease, knows that we exist, can direct the family to us for support services, but also recognises the value of the various other health and social care professionals. So the mental health practitioner should be engaged at an early stage. Social work should be engaged at an early stage. Physio, it's less vital that they're engaged at a very early stage, but there's lots of things that we know in terms of Huntington's disease and general health and well-being that's important for somebody to know. So we want to try and raise that awareness from the point of contact and get as many people engaged as possible. And this morning I had a meeting with the mental health leads for multidisciplinary teams across 5 different GP federations. The infrastructure isn't particularly straightforward at all, to be honest. There's no clear-cut areas, and it's kind of difficult to find the right people sometimes, but the people I was speaking this morning would have responsibility for over 50 GP practices between them, and they lead on the mental health side of it. So they have agreed then to share our training, and we've got some up training sessions coming up, to share their training with all of the staff across those 50 practices, and also to reach out to colleagues in other GP federations, flag up that we'd had a meeting today and to get them to engage with us as well. So slowly but surely we are reaching more people, and it's going to have a very positive impact. And the other thing to say, I guess, is that we secured some funds from Roche Pharmaceuticals, and Roche are one of the, I suppose, 3 companies at the forefront, I suppose. Lauren, that'd be right. I suppose 3 really in the lead as such with HD therapies. But Roche are particularly invested in reaching out to the HD community and trying to engage the community. So they've been really good at providing practical and, in some sense, financial support to HD associations around the world. And they have funded a regional HD awareness campaign. So ourselves and our colleagues in Ireland and Scotland and England and Wales are working together to produce a 4 regions awareness strategy that we are using a PR company based in London to develop with us. And that's going to involve, it's going to involve some of you for sure. We'll be reaching out to HD families locally in all of the regions to try and get their input and experience. And Azealia will tell you a bit more about that during the support groups and that. But what we're trying to do is to tackle some of the stigma around Huntington's disease and to try and encourage more families to reach out to local supports. So we're hoping that that's going to result in more HD families coming forward and reaching out to HDANI for information and support. And it'll allow us then to connect a bit better. So it's going to involve some social media work, but also press and PR work, as well as public affairs and lobbying stuff as well. So it's going to be quite a lot of activity around the May time on that, and we'll be using that as an opportunity to sort of springboard more training sessions and resources with health and social care professionals. So at the minute we've about 2,500 health and social care professionals on our database, and Ashley has been a real trooper recently, ringing around every GP practice in Northern Ireland to get their email address, which isn't an easy bloody task. I tell you, these information by GP receptionists are guarded probably better than Fort Knox. But we've made a really great inroad. So there's about 35 people already booked in for some of the sessions. I guess next week, yeah. So it's really good. And then the other day as well, I had 27 grief counsellors engaging in an awareness session too. So that's a really positive work in terms of reaching out to the communities. But I guess a lot of it is going to depend on word of mouth from service users as well, bringing in other family members and making sure that they have access to information and support. Yeah, so I'll give myself a break for a second and pass you over to Lauren. Maybe you could talk for a few minutes about the importance of getting the community involved in research. Lauren. Sorry, Lauren, you need to unmute.
Sorry. Yeah, I think research you know, to me is extremely important in terms of getting us closer to having any therapies that are going to help patients with Huntington's over here. I know the benefits of taking part in research. I've done a lot of it myself, just to be doing something that you can productive and towards helping, you know, find a cure and doing that. I think it also helps in terms of care. Getting research over here might be a way to help build this idea of a multidisciplinary team and specialist care for Huntington's disease. I've been trying to work with Seamus and see what the barriers are, but unfortunately we're trying to fight an uphill battle in Northern Ireland, where there's lack of resources for neurology and services anyway. I think they're under resourced by at least 20 neurologists, so it is hard to get kind of these up and running when these doctors have to care for all these other diseases and don't have the bandwidth to kind of focus on Huntington's. But we're making progress and doing what we can. I think in terms of linking in with the youth, that is where a lot of the focus is now going in the global research community for Huntington's, because we're starting to realize that if we do want to treat people and slow the disease or stop it, hopefully, probably the most important time is to start treating before people ever get symptoms. So to do this, we're trying to do research in younger people very far from onset, and to learn more about very subtle and changes that happen long before clinical symptoms come out. That's kind of why it's important. There is the one thing I can say for anyone, it's frustrating back at home that there's not much going on, but just to give some hope is that there's so much happening globally for Huntington's disease research, and the pace of research at the minute is very exciting. It's not fast enough, obviously, for yourselves and for our loved ones, but that's the only thing I can communicate, is that there's a lot of very devoted people that are working hard to try and cure this.
Lauren, is there anything you'd say is unique about the global research community in terms of Huntington's disease compared to other conditions?
The nicest thing I found when I joined the community, because I was quite skeptical moving into Huntington's disease research. You know yourselves, we don't really have positive contact with professionals because they don't really understand the disease or have maybe never met someone with Huntington's, and it's just very difficult to work with. So going to UCL and actually meeting doctors that really understood it, and not just it as a movement disorder, they understand the real unique behaviors and things that are really very specific to Huntington's, and the care that they treated patients and families with was a really nice thing to learn. And then going to research conferences and that, it became obvious that how unique Huntington's was compared to other diseases and other fields, and that it's very collaborative. And there's I think that's been set out because of the family aspect of Huntington's, and right from the discovery of the gene itself, which was a global collaborative effort. No one got named on that paper as normally people do, and it's a real legacy for the continued Huntington research. We're also lucky we have there's a non-profit company called HDANI, which has a very large has an anonymous donor who gives very large amounts of money to Huntington's disease research, which is really why we're a lot further than we probably should be for such a small disease. So I know from colleagues that have come from other fields get particularly kind of drawn into Huntington's as a field, and quite often don't want to leave. So you get, you know, very clever people that get stuck in Huntington's disease research and really motivated to stay in it. Yeah, so it's a real pleasure to be working in it. I feel very, very lucky.
Yeah, it does seem to be a real collaborative effort. Even though there's a commercial interest from pharmaceutical companies, and they all want to be the first one to get the therapy out there that can help prevent onset or delay onset. They all seem quite keen to work together and to share information. And I suppose the Enroll study is part and parcel of that as well, that everybody has access to the information that's derived. So we're working with we have a meeting with genetics, the genetic service soon. My diary is a bit of a nightmare, so I can't even tell you when it is, but it's soon. And there does seem to be a real commitment from the genetics team to get more involved with Huntington's disease, even though it's just one of many conditions that the service work with. And even though we know the impact of Huntington's disease and how profound it is for families, really, as Lauren said, the numbers are relatively low compared to other conditions. So we do have to fight to some extent to get our case heard, but I think once we do get an inroad with an organisation or an individual or professional, they do seem to invest themselves and to recognise the importance of the work that we're doing. So we're hoping that the engagement we have with the genetics service will be really productive for us. And as a kind of a backup as well, we've got commitment from a team over in Birmingham to come over and do a satellite Enroll HD clinic. So they're already established in Birmingham, running a clinic there, and they have a number of patients and people that they see, but they'd be willing to come over to Northern Ireland and see some patients here, and also help train staff on the ground here as well. So if the genetics team, for example, were willing to establish an Enroll site, they would help them get it set up and provide some training on what they need to do. So that's really positive. And COVID has just put a dampener on things, to be honest, because we were all sort of full steam ahead to have things going, but we just have to keep pushing things back a little bit. But we'll do the groundwork in the background in the meantime, and hopefully when restrictions ease, we'll be in a good starting point then. So that's a wee bit about our research. I'm going to give you over to Raymond for a sec to talk a wee bit about our finances and not. And if anybody has any specific questions about finances, they can come back to me and I will give you the real nitty-gritty detail that you want. But if you just want a general overview, Raymond will give you a bit of a heads up on where we're at with things. So you unmute yourself, Raymond.
That's great. Thank you very much, Sorcha. I suppose, like any organisation, we need finance to keep the charity running. I suppose thanks to previous boards and people over the years, there are funds in reserve, but obviously we're still very dependent on donations from volunteers, for grants from various organisations and sponsorships from businesses. I think Sorcha said earlier, the day-to-day running of the financial side of it is pretty much between Sorcha and a guy called Tony Clark. Tony has an accountancy business and they do the day-to-day administration. I get involved once a month with authorization to so they have a separation between the people asking for the payment and the people actually making the payment, and that's to ensure that the money that has been raised by various people or donated or given by grant is properly dispensed. I have to say that this is the first charity I've been involved with, but I mean, it is very well managed in terms of the finances. And it is, they do forward plan, and in conjunction with Tony Reserve to ensure that both the short and medium term functioning of the charity can continue, even if donations and various things were to stop overnight. Part of that is Sorcha's role. She spends a lot of her time on applications for grants from various organisations. This year I've been involved with her on at least one occasion and I tell you, it's a bit of a daunting prospect dealing with some of these people. They're very nice and whatever, but it's just they are quite demanding in terms of the information that sometimes they ask for. And Sorcha is, while she says she's persistent, she really just gets stuck in and doesn't take no for an answer. So she's working very hard on things like that. We had planned as a board to recruit additional member of staff, But in light of what's going on in terms of the funding and whatever, that has been put on hold in the meantime. So it's something that we hope to come back to at a later date. But at present, it's on hold. We are like most charities at the present time, with COVID and with Brexit and whatever, businesses aren't really getting involved in sponsorships the way they might have done in the past. But we're always keen to speak to anybody who may have a potential business that they know or have a personal connection with. So I would encourage anybody who is aware of any business that they think might be prepared to help the charity. If they let either Sorka or myself know, we will make contact with them and see if there's something we can do along that side. Obviously, fundraising continues, and that's down to the volunteers. One thing I would maybe just like to, before I finished, it would be to plug something coming up that Ashley's involved in. While she doesn't participate herself, she coerces other people to participate in Belfast Marathon, and I believe there's another one coming up in September. So she's keen to organise a relay team, and there's also an 8-mile walk. So I would say if anybody's looking for an opportunity to do a bit of fundraising, maybe that's something you should do. And she's just put a message up to say she's taking part this year. That could be interesting. I have to admit, I will be taking part this year as well. So, but as I say, it's something I would encourage. It is a good opportunity, and it's an opportunity to. So, to say, just to go back to the finances themselves, they're in a very steady state at the present time. We obviously, the more money that can be brought into the charity, the more work that Sorka and the staff can do, and that's important, and that's to the benefit of the families and whatever. So that it is important to keep the money flowing through, but you can be assured that it is extremely well managed, and the money is being spent wisely for the benefit of the people involved with the charity. I think that's all I'd like to say at present. If there's any questions, maybe send them to Sorka and stay out of it. Thank you, Sorka.
Thanks, Raymond. Yeah, the main grant that we're waiting for feedback on at the minute is to the big lottery. I suppose there's different ways to look at funding. We get bits and pieces of money through all the time, from donations, fundraisers, and that could be, from £20 to £2,000. That's what we call kind of unplanned money. So it can come at any point, but it's really important for service delivery that we have money that we can be assured is there. So that's where your grants come in most of the time. And again, grants come in all kind of shapes and sizes. And what we tend to do is to devise a project that works over a number of years. So, for example, the project that I'm currently working on is for a 3-year project. And that is kind of supporting families project for 3 years. And that incorporates the majority of the work that we do. And if we are successful in getting everything that we ask for, it'll mean that there's 2.5 family support workers, and also some education and awareness work ongoing. And then it'll cover some of the costs towards the work that I do in terms of training and lobbying and things like that. But in order to secure funding for the project, you need to have your 3-year project plan and everything that you'd like to do. And then you need to magically be able to say where are you going to get all this money from before you ask anybody for money at all. So that's the kind of some of the trickier aspects of it, is identifying potential funds that we could go to, that we meet the criteria for this. So there's a lot of kind of background research involved in that. There's probably 800 or 1,000 different grants available for work in Northern Ireland, but HDANI wouldn't be eligible for them all. So some organisations don't provide grants to, like ourselves, disease or condition-specific charities. It's too focused. Some only provide grants for work in certain areas in Northern Ireland. So we might have to apply for a grant to do some support work in County Londonderry or within a particular trust area. So it's a real kind of patchwork quilt of funding that we need to attract. The biggest aspect of the current project that we're planning for is with the big lottery, and we're asking them for just over £275,000 for 3 years of work. Now that's more money than we've asked them from before, but what we've done is basically build up an evidence of the work that we've done over the years and how valuable that's been to people, and how many people we've reached in that time, how many health and social care providers we've contacted, what kind of difference we've made to individuals' lives and to individual families. And then some of you would have engaged in the consultation work that we did before Christmas, I think probably September time, when we asked you, you know, what would you do if HDANI didn't exist? Where would you go if the charity wasn't there? Where else would you get information? And that mostly told us what we knew, which was there's nowhere else. There's nowhere that provides the same service as HDANI. There's so many gaps there that people really don't know where to start. So we've established then evidence basically of what we call the need for our work and also the impact of our work. And off the back of that, we've developed the services that we already have. So we knew that providing a family support worker is really powerful for people, and that they have access to information and advocacy services and support. But we know that one family support worker is just not enough. We know that 2 family support workers aren't enough. So ideally we'll have 2.5 family support workers to cover all of the families in Northern Ireland, both the ones that we currently engage with and the ones that we hope to engage with in the future. So it's about kind of building that picture of evidence and saying, this is what we do, this is what we do really well, this is what we'd like to do different, this is what other people would like us to do, and putting that all together into a project plan. And then, as I said, trying to magically pull money out of the air. So the grants are really important for planning work, but also you need to be able to show that there is support for the work that you're doing, and part of that is shown through donations that you receive from the public. So if people felt that we provided no benefit whatsoever, they wouldn't bother to support the charity. Whereas on the flip side of that, we know that families who really benefit from our support are actively engaged, and they really want to go out and they want to make more money for the charity so that we can continue to provide the services that we do. So it's a combination of those things that help us to do what we do. I'm going to hand you over to Janice for a minute, who's going to talk about her experience of fundraising. I'll tell you from the outset that Janice's family in Armagh were absolute troopers. Now, a few years ago, we're still seeing the benefits of the money they raised, which we ring-fenced for youth services. And even though we haven't been able to run physical events this year because of COVID, we've still been able to have the benefit of that money to help towards some of Ashley's costs, to help Ashley provide information and online services and keep people connected through social media and WhatsApp, and allowed us to send out care packages to the youth at Christmas and things like that there. So even though we can't physically see people, we're still providing the service and making sure that we're up to date with information and keeping people connected as best we can. So I'll pass you over to Janice now.
Yeah, just in 2017, we decided we wanted to do something for Dad, in memory of Dad. So talking about the marathon, the Belfast Marathon, we decided we'd do a relay and we'd do some fundraising to raise money for it. We couldn't believe the support that we had got. We had done a coffee morning and a cake stall and craft fair and a barn dance. And we had the coffee morning in March time, and the queues out the way down the road from early morning, we couldn't believe, and strangers coming to help us, to bake for us, and they couldn't do enough for us. And we had raised £8,000 on that day just for the coffee morning. And then we had a barn dance, and we were just overwhelmed. We had over 1,000 people come through the doors. Just everybody in Armagh was just so good. So between it and the coffee morning, we raised over £41,000, which we were delighted. You know, it was just, everybody was just so good, and the support was just brilliant. And they were actually glad to support us because they were saying, you know, about cancer, they were always donating to cancer, and nothing was coming out of it. So they were glad to have a different charity and hear, and hear your story. I think if you have a story to tell, it definitely helps. So it does. And then last year me and my husband was going to do the half marathon, Belfast half marathon, but because of COVID, it was all cancelled. So we decided, my brainwave, my husband, not so much. One day we're out for a walk, we decided we would walk a marathon. So, and the support we got for that as well, we've done that at the end of June. And at that stage, I think there was about 15 people allowed to walk with us. So it was 15, there was more people had asked, can we come and walk with you? So we had 15 walk the whole thing with us. And then there was ones had met us up along the way and walked with us, and we'd raised over £3,000 just on that as well, virtual. So it was absolutely brilliant. And the support that we have, the local support with anything we do, is just come out and their droves are just like, it's unbelievable. So it is.
One of the things that I thought was particularly striking about your initial fundraising, Janice, and the barn dance and the coffee morning, was how much your whole family got involved.
Yes, because I am very close to my cousin who has Huntington's, and you probably have Hawthorne. You probably know the Hawthorns, and we done it together, as two families, and like everybody was, everybody just got stuck in and helped, and so they did, and it was great. It definitely was.
And would there have been much talk between the families about Huntington's disease before the fundraising, or did that make a bit of a difference?
As Helen and her family, they had done a relay a few years beforehand, and then it was then it was sort of, because before, whenever like my dad, we sort of just had got to know about the Huntington's, so the charity, so it did, and then whenever Helen sort of was tested positive, and then once they'd done their fundraising, then they had reached out, and you had reached out to them, and it was true, so just everybody just got in, and everybody's support was brilliant. So
yeah, we see fundraising is a real opportunity sometimes to break down the barriers that can exist in families talking about HD. And sometimes we'll get people reaching out to say, oh, they want to make a donation, or they're thinking of doing a bit of fundraising. And then we'll always follow that up to connect them with, say, Zélie, to see if there's any opportunities to support the family or provide them with information. So sometimes it can be a bit of an icebreaker. And then even families themselves say, nobody really talked about Huntington's disease until, I was running a coffee morning, or I was having a bake sale or whatever, and then it kind of opened up conversations a wee bit about it. So it can help to break down some barriers as well. And you can see families really can bond over the whole sense of kind of community around it as well, which is great. It's really beneficial for people. Obviously, the charity and our service users benefit from fundraising, but I think individuals and families themselves can benefit too. And I suppose that, like I said, with the money that Janice's family raised, we were able to set that aside, and we talked to them about what they wanted to use the money for. And because there were a lot of young people in the family as well who would be at risk of HD, that youth was something that they wanted to support. So the board members were able to ring fence that money and say, well, this is only going to be spent on young people. And because the number of young people that we engage with is relatively small, it means we can make that money last for a bit, so we still have, I want to say, probably around £20,000 there. That'll mean that we can plan ahead for a summer camp, and we can plan ahead for specific events and things like that. So once we had that money from the family, we were able to plan out for the next sort of 3 or 5 years of, well, instead of just waiting to see if we might get a grant sometime to be able to do something, we're able to say, look, we will hold an event every term time that there's a break. So generally speaking, we hold something in January, February time around midterm. Easter, we have a residential camp in summertime, and then we do something around Halloween. And there's some sort of engagement maybe around Christmas time, depending on people's availability as well. And we try and spread that out across the province so that we're not always in the one place all the time, and that families from different areas can get a chance to take part as well. So it's really important to help us plan our services when we know that we have money that we can set aside. Amy, maybe you want to pick up a wee bit just on how you find the youth and how you think that's benefiting. Or your thoughts on it?
Yeah, so when I first started with the charity, the youth seemed to be quite big. I don't know if it felt big, there just seemed to be a lot more involvement than I think there is now. Went a bit downhill. So I think it's really important to try and make it the best it can be. Although a lot of what our charity and people researching Huntington's and stuff is doing might be too late for some people. The youth that are coming up, and however many more than are at risk, it could be perfect timing for them. So I think it's really important to educate and involve them as much as possible. Kids these days are hard. Like, usually if it's not on an app, then they don't want to know. So I am currently trying to do some research to see what other charities like ours do, just to see if there's anything that we can change or do better. I say there's not as many involved as when I started. I hope it's not me. But I think it's really important. I personally have 2 younger brothers and then 3 younger cousins. So I'm the oldest, and I think you kind of feel a bit of protection there too, that you should be trying to help out as much as you can, and they're the future of this. So what they know now or gets instilled into them now, they can then go on to do more in the future. So I'm, as I said, trying to do some research at the minute to see what we can change or improve. Any ideas, feel free. But yeah.
Amy, have you reached out to HDO? Oh, you're so muted.
Sorry. Yeah, I'd actually sent a message there to Matt. Me and Sorka had been talking about this about a week and a half ago, 2 weeks ago. My hours at work have now went up massively. I work in the events industry, so it's a bit all over the place at the minute. But yeah, HDO is probably one of the best places to start. I was lucky enough to go to their European camp in 2016 or something, I think it was, maybe 2015. And it was amazing. And I know that because we're Northern Ireland, it can seem like we just get forgot about. But yeah.
Well, yeah, it'd be great to have more people from Northern Ireland attending the Congress now that it's virtual. So maybe
Definitely.
get more advertising the word out for that. I'm on the board of HDO as well. So
oh, brilliant.
If you need any like connections.
I do think doing it virtual this year, like you say, will be a much better way to get higher numbers, because I know that usually, or even like Kent, there was only 5 people or so who were allowed to go over. So I'm sure that some people might think, oh, well, I wanted to go, or why not me? And trying to pick who goes could be really hard. So yeah, I definitely think virtual is very good this year.
I don't think they have the agenda up yet, which is probably why it'll be slow. Once they do that, they'll probably get more people signing up.
Yeah, thanks very much, Amy. Yeah, so that's I kind of touch on what we're looking at there in terms of the youth. So Ashley's been continuously engaged with people through their parents and through young people themselves via WhatsApp or social media, and we're between what we're doing at that level and then what Amy's looking into to see how we might better engage and reach more people. We're hoping then that'll have some impact in the coming time as well. The virtual Congress would be interesting as well, but sometimes like we've made things available, the number of people actually wanting to attend has been poor. So that's what we're trying to kind of get around, because we're constantly asking people for feedback on what they want to do, where they want to go. And sometimes you get initial feedback to say, oh, we want to do this, we want to do that. But when you go to book something, then people just either don't show up or they don't bother engaging. So there's some sort of a barrier there, but I'm reassured having spoken to other organisations that work with young people and even with HDO and that themselves, that it's quite common. The level of engagement wanes. So we can kind of keep working on it anyway. I'm going to hand you over to Richard now before we finish up, and Richard's just going to speak to you a wee bit about the importance of the connection between service users and trustees.
Hi, can you hear me okay? Thank you. As I said in the introduction, I first got involved with what was then the Belfast group, but it was trying to represent all of Northern Ireland. And it was very informal. We got together on an evening in Belfast City Hospital and did what would be minor business of secretary saying something, a treasurer saying something, but it really was a good chat, get together. Today, it's obviously, as you've seen and heard today, it's a much more formal gathering, get together, and Sorka and company look after all that day-to-day business, which we could never, ever have looked after. So the organization has grown, so that's brilliant. Today, in terms of communication, I have some concerns, and I think that we could have to reach out more, as Sorka has said already. We already have the Zoom meeting going with the service users, and Zilly and actually been good in involving and getting people going on that. The question I would ask the people involved here is, it's a very sound group, the one that's going now. It's a small group, and I wonder if it was a much bigger group, would it lose some of that soundness? People wouldn't be able to maybe make chat as well as they do. So should we have more of those Zoom groups going? If we do, how do we do that? So I think that's an issue that we should look at, because at the minute, well, it's reaching out and reaches out to people in Derry and Carrick and all over Northern Ireland. But, and that's a good thing, because I think we get to know each other much better. But I feel that perhaps we should have more groups going. How do we communicate again? For me, when I was involved in that initial Belfast group, coming out of isolation was so important. I've been working on my own. I felt very isolated, but now I feel there's more opportunities. The situation at present with COVID-19 has meant that we can't get together, obviously, as much as we would like to. On the other hand, it has raised opportunities through the likes of Zoom to get together, and WhatsApp groups going as well. So there's opportunities there that we could perhaps capitalize on some more. Should we be making phone calls to each other in sort of a buddy type operation as well? And I'd like to hear back from the members, just how do we improve that communication? Through the magazine that we have as well, how often should that go out? I'd like to think that whenever regulations are eased a bit and we can move around a little more, that perhaps I can get out more and meet other groups in other parts of the country. So I leave it with you there, Sorka. Thank you.
Great, thank you, Richard. So it's always been really important to make sure that the work that we're doing is what's needed by people on the ground and what's wanted. And I think just like anything in life, I personally say you can't complain about something if you're unwilling to put up your hand and say and try and make a difference. So it'll be impossible to please everybody all of the time, but certainly we do take as much feedback into account as we can. So we've looked at, for example, whether we would set up a new group over in the Derry area, because we've got a few families there. So that's a possibility. And then we also look at maybe down around the Enniskillen direction, because we have a group in Omagh. But if it's something that maybe we would look at moving the group to have it in Omagh 1 month, then Enniskillen the next. So because our numbers are quite small in terms of the number of people who actually want to attend a support group or want to attend events, we need to be quite flexible and creative about how we do things and make sure that we give people as many opportunities as possible to engage in whatever way suits them. So some people simply don't want to engage in Zoom, even though they might go to a physical support group. And we're seeing that reflected in the numbers of people who are using the group. And then other people find the Zoom is really good because it means they don't have to leave the house and they don't have to deal with all of the physical, logistical and hassles of trying to get from A to B and everything that involves. So I think going forward, regardless of what way COVID pans out, we will hopefully be able to bring people physically together soon. But I think we'll always keep this virtual aspect to it as well, because it gives people that more of an opportunity. And we've had to be Yes, creative and proactive as much as possible in terms of communicating with people. So at the start of the COVID lockdown, we went through our database and did an audit to make sure that we had up-to-date information on all of those 750 people that we mentioned, which was no small task. But we made first contact with people with whatever way we could. So we emailed, we didn't get a response by email, then we phoned them if the phones weren't being answered or if people weren't picking up, then we sent a letter in the post. So we wanted to make sure from the outset that people knew that we were here, what we were going to be doing, and how they could get in touch with us. That even if COVID meant we were going to be locked up for a couple of weeks, or it feels like a couple of years now at this stage, but that we were still going to be available there. And we worked then with local communities who were on the ground, so providing the essential services, food, medicines, etc. So we prioritised the people that we knew lived alone or that maybe didn't have great family support. We'd make regular phone calls to them. Then we have the WhatsApp groups, we have email communications, e-zines, and then the virtual support groups and that. So we've tried to be as creative and responsive as possible, but any of our service users have any thoughts about things that they might be preferred to engage in, as Richard said, please get in touch, because we really rely on you to tell us what you need and when you need it and how you need it, and we'll do our very best to deliver that. We can't guarantee, as I said, that we can make everybody happy, but we'll certainly try our best to support people as best we can. I think that's pretty much drawn it to a close. Kathleen, before she left, had asked a question about the HD nurses, and I'll just make a point about that before we finish up. So we know at present there's only one Huntington's disease nurse specialist, and that person is only able to see people who live within the Belfast or Southeastern trusts. And work that I have been slowly chipping away at over the past few years has been to increase the nursing provision. We've done a lot of work around demonstrating where people are with Huntington's disease physically and where they're located around Northern Ireland, to be able to map out where people are and where the gaps are in service provision. So the last piece of news, I suppose, that we had was that there's a commitment to recruit an additional Huntington's disease nurse. This is currently, I'd say it's out for recruitment, but I can't quite clarify that, because when I've contacted the trust to get some information around the timeline on that, they have said it's with the business services organisation who are responsible for recruiting. When I contact the business services organisation, they ask me for a requisition number, and I go back to the trust and ask for a requisition number. They say, oh, we don't have a requisition number. And the business services people say, sure, we can't advertise without a requisition number. So there has been a commitment to employ another HD nurse, but where exactly that is in the administrative land of the HSE, I can't tell you for now, so I can't give you any assurances of when it'll happen. But I will tell you is that we were pushing very much for equity of service. So it doesn't matter if you live in Derry like Simon, or if you live over in Belfast or wherever you live, you should be able to see HD nurse. It's not right that only people in Belfast or the Southeastern Trust can access Magella services. It's just completely wrong. So it would appear that they have listened to some extent, and 2 nurses is still not going to be enough, but it's better than 1 nurse. But they haven't particularly paid attention to the fact that it makes no sense to place 2 nurses in the Belfast area and have people travel, or have the nurse spending their time travelling across the country. So we're going to keep pushing and pushing for this. What I talked about earlier is a HD regional strategy. So it should really make it clear from the outset that no matter where you live in Northern Ireland, everybody gets access to the same care pathway, the same service, whether it's access to predictive testing through the genetic services, or through the likes of social work or physiotherapy or OT, that there's a clear pathway for everybody. So what I'd like to see happening is that these HD nurses are employed, great, fantastic, but that they're used properly, that they're not wasted, and they're not spending half their time running the roads trying to find people, or sending people from all over the country to Belfast in order to be seen. So what we'd like to see, even in the absence of a HD nurse in each trust, is a dedicated person, a dedicated individual who is responsibility for Huntington's disease. So that regardless of what trust you live in, a GP can look up to see who is responsible for Huntington's disease in this trust and contact them and make sure that that person then gets proper referrals into appropriate services at the right time. So it's going to be a continuous battle, no doubt, particularly with all of the demands that COVID have placed on services, and not least on money. Resources are going to be increasingly tight across the trusts. So we're just going to have to keep chipping and chipping away at it. And as I said, the work that I'm doing with the multidisciplinary teams and the GPs should also have a beneficial effect in terms of accessing services at the appropriate time as well. So it's going to be ongoing, but there should be some good news in relation to Huntington's disease nurses in the coming months, I would hope. As soon as I can get people to track down where things are at, I'll update service users, but it's a bit of an anomaly at the minute. Does anybody have any questions before we wrap up? Okay, well, if you think of anything, feel free to reach out either to myself or Zélie. We're going to share this with service users, so if anybody else has any questions, they can get in touch as well. And as we've mentioned, just a few things there. So if you have any ideas in terms of youth engagement or access to research or more interest in service users or fundraising, anything at all, just give us a shout. Okay, thanks very much for your time, folks. Bye-bye.